Welcome to The Explainer. Today, we're talking about opioid addiction treatment, the science and the history behind it. Is it a moral failing or a medical disorder? This one question has shaped everything. Let's dig in. And the scale of this is huge. We're talking nearly 900,000 heroin users in the US alone. So, how we've seen addiction has changed a lot. It went from a medical problem to a crime. And that image of the street criminal instead of a patient, well, that stigma really stuck. But then, in the 60s, science started to catch up. Researchers saw it wasn't weakness, but a brain disorder. So you had pioneers like these three, and they asked a game-changing question. What if medicine could help? And what they found was wild. Opioid addiction looks a lot like diabetes or hypertension in almost every way. This led to what we now call medication-assisted treatment, or MAT. It's not just meds, it includes therapy too. Now, the whole point isn't trading one drug for another. It's about leveling out the brain chemistry. So there are a few FDA-approved meds. Some manage cravings, while one actually blocks opioids from working at all. And this isn't a one-and-done thing. Treatment is a journey with clear phases, from stabilization to long-term care. Right, so it's a whole package deal. The meds are just one part of a much bigger support system.
Okay, so we know this stuff works. The science is solid. But there are still some major roadblocks.
That old stigma of it being a moral failing is a huge one. Plus, there's just not enough funding or access. So it all comes down to this. If the science is so clear, what's really holding us back?